Fortunately, because this one is rarer, there is no vaccine right now.
The current strain is quite serious. The strain that you've heard more about is called the Zaire strain, and that is what we consider the most serious. The current strain is called the Bundibugyo strain, and it's pretty rare. This is only the third outbreak it's ever caused. So it's quite serious in that we estimate it has about a 50% case fatality rate if untreated. The Ebola virus is actually a group of viruses. It is a genus of viruses with a number of species in it. And so there's about 5-ish viruses, we'll say. And 3 of them cause most of the human disease that you've heard about. One of those is currently transmitting and causing an outbreak in the Democratic Republic of Congo and Uganda. Ebola is transmitted from a person who is infected and symptomatic to a person who is susceptible via bodily fluids. So it could be anything from blood or vomit, things like that. And it really is close contact. So this is often a virus that is transmitted to caregivers, so medical personnel or family members, household members, and it's not a casual contact transmission. Obviously, this is a big deal because public health is global health. We're all connected, and one of the things that we know very well is that mobility and movement across the planet happens very rapidly and very easily, so diseases can spread, but beyond that, we are all really connected, right? So negative health impacts in one part of the world really do affect us all, whether or not we get infected.
It causes symptoms very similar to other common illnesses in Africa, such as malaria or influenza. So a person will present with fever, headache, vomiting, diarrhea, and these mimic those other diseases. So we think and then begin to treat for those. And because Ebola is not as common, we don't first think of that, and that is a very dangerous period of time because we miss that diagnosis. The virus is transmitted through saliva, through feces. So typically for Ebola, there would first and foremost would be a vaccine. So there is a Unfortunately, because this one is rarer, there is no vaccine right now.
India and the African Union have postponed the India-Africa Forum Summit, which was scheduled to be held in New Delhi later this month, amid growing concerns over the Ebola outbreak in Central Africa. The outbreak is centered in the Democratic Republic of Congo, where according to the UN, there are nearly 600 suspected cases and at least 148 suspected deaths. Neighboring Uganda has also reported 2 cases, including 1 death. The World Health Organization has declared the outbreak a public health emergency of international concern, although it has said that global risk remains low for now. What's worrying experts is the strain behind the outbreak called Bundibugyo. Currently, there is no vaccine or medicine to treat it. The WHO chief has also warned that the outbreak was detected late, resulting in the deaths of healthcare workers, and that movement of people in the region could accelerate the spread. Ebola spreads through direct contact with bodily fluids of an infected person, including blood or vomit, or through contaminated surfaces. People usually become infectious only after symptoms emerge. India has now issued a health advisory for passengers arriving from or transiting through affected countries, while reaffirming support for Africa-led efforts to contain the outbreak.